Okay, thank you very much. Hello, I'm Lorna McLintock and I'm the Medical Director at the Scottish National Blood Transfusion Service, and I'd like to thank Haemochromatosis UK for facilitating this webinar today. So we've come along to tell people with genetic hemochromatosis about becoming a blood donor with the Scottish National Blood Transfusion Service, and so that's the focus of the presentation today. I'm just going to introduce the team that I've got with me here today. We've got Ewan Dalby and Pam Fiddis, who are members of the donor medical team at SNBTS, and they're both general practitioners, and they look at the referrals that we get from clinicians. Who refer in individuals that have got genetic hemochromatosis and assess those referrals and allow those individuals to go on and become blood donors. I've introduced myself, Lorna McLintock. I'm also a consultant haematologist and I used to work in NHS 5. I worked there for about 13 years where I looked after patients who had genetic hemochromatosis. And last but not least, Jennifer Wilson, who's the head of our donor and marketing and engagement team at the Scottish National Blood Transfusion Service. So in terms of, what we're going to talk about today, it's how people with GH who live in Scotland can become blood donors. And first of all, I'm going to talk a wee bit about some work that the Scottish National Blood Transfusion Service have done with Haemochromatosis UK. And then I'm going to go on and talk a little about the eligibility criteria that apply to donors and specifically those with genetic hemochromatosis and how you can sign up to become a blood donor with the Scottish National Blood Transfusion Service. And then there'll be time at the end for us to take some questions and hopefully answer those questions for you. So first of all, I'm just going to talk a little about the work that SNBTS have done with Haemochromatosis UK. In spring 2023, we worked with Haemochromatosis UK to do a survey of Haemochromatosis UK members, really to find out about attitudes and behaviours and knowledge about blood donation as part of treatment for genetic hemochromatosis. The key objective of the research was to better understand the awareness of blood donation and the experiences of GH donors registering to donate blood since April 2020. And the reason that we picked that date is we had quite a big change to our processes at that time that hopefully made it easier for individuals to become blood donors. And we hope that the findings could be used to improve the donor experience and meet the needs of individuals with GH who wanted to become blood donors. So the survey asked 31 questions and we got 192 responses from people in Scotland. And thank you to all those who participated in it and for Neil for facilitating the survey. In terms of the findings of the survey, the themes were that there was a lack of awareness of blood donation as an option for individuals with genetic hemochromatosis, although there was a real clear desire to be able to come and donate blood, and people could see the benefits of blood donation from individuals with genetic hemochromatosis. The survey showed that the 12-week blood donation frequency, that's the interval at which you need to wait before you can come back and donate a further unit with the Scottish National Blood Transfusion was actually sufficient for the vast majority of people with genetic hemochromatosis, although not all of them. It also highlighted about 24% of people who were registered as blood donors who had genetic hemochromatosis had never actually made it along to give a donation. We identified that generally people were able to get an appointment that suited them. However, people did find the referral process somewhat variable, some with good experiences and some with less good experiences. So following that, we wanted to kind of try and make an action plan to make things better. So we created a new information leaflet. You can see that on the right there, Haemochromatosis and blood donation. And that was really kind of to try and increase awareness and explain the process about becoming a blood donor with the Scottish National Blood Transfusion Service. And we've distributed those very recently out to as many of the venesection or areas in Scotland that undertake venesection, so that there can be a sort of a greater awareness among individuals with GH and with clinicians that are looking after patients with GH. We also did a survey of our referrers, kind of just to understand any problems that they might have within the referral process. And following that, we developed a frequently asked questions document, which was shared with our clinical teams. And then currently we're doing a survey of those who have registered to become blood donors but not yet donated. That survey's closed, but we haven't as yet analysed the results from that. So that's a bit about the work that we've kind of done to date to sort of, try and increase awareness and improve the experience for everybody involved in the process. And now I just kind of wanted to talk a little about the guidance around blood donation. And the guidance that we have around blood donation is set by somebody called JPAC, who are the Joshua Transplantation Services Professional Advisory Committee. That's a bit of a mouthful, isn't it? So that's why we call it JPAC for short. And they have this book called The Guidelines for the Blood Transfusion Services in the UK, and they've also specifically got guidance about blood donation. And that's the rules that we have to follow throughout the UK. And these rules are in place to keep both patients and donors safe. So all blood donors in the UK are voluntary unpaid donors. The guidelines exist to keep volunteer donors safe, to ensure the quality of blood collected, to keep patients receiving the blood transfusion safe. And because of that, we have got these guidelines, and there's more than 200 rules around blood donation to keep both the patient and the donor safe. So in terms of kind of the next step about sort of when you come along to give blood, we've got this information leaflet called Giving Blood Processes, Risks and Information. And it's important when anybody comes along to give blood that they kind of understand the process, the risks, the benefits, and have time to read and understand that information. So that's available on our website. We give it out to people when they come along to donate blood. And each time somebody gives blood, we must be happy, or they must be happy that they have fully informed consent about, what the process is that they're going to undertake. So the first step is that leaflet, and then the next step in the process is, you'll see at the bottom there, it's got a sample written over it. That's our donor health check. And when you come along to our blood donation centre to donate, we ask you to fill this questionnaire in every time. And there's 30 questions on our donor health check, and they relate to your recent health or your long-term health, about where you've travelled recently, and some lifestyle questions. And I'll show you some of those in a bit more detail further on. And additionally, there's 13 questions for new donors or donors who've not donated in the last 2 years. So it's a lot of information, a lot to take on board, but we've got information on our website, and you can get in touch with our donor advice team in advance of the session to discuss any questions or concerns that you might have around blood donation. And we also, if you go onto our website, we've got information about eligibility for blood donation. We've got a Can I Donate quiz that kind of takes you through some of the sort of common reasons that you might not be able to give blood. And it's also got a specific section on haemochromatosis as well. So that's on our Scot Blood website, www.scotblood.co.uk. And there's lots of really useful information about blood donation on there. In terms of, for the people that do come along to donate, you can always donate every time you come. We call this, if you can't donate because you don't meet some of these blood or donor safety rules, we call this deferral. So the common reasons that you might not be able to donate blood on any one given day is that your hemoglobin's low, that you've travelled to an area that puts you at higher risk of an infection and you're not able to donate blood that day. So one example of that is if you've been to an area where malaria is common, you can donate blood if you've been back for 4 months and we've done a blood test to confirm that you've not had malaria. But there are a number of rules about travel that we need to consider, and depending on where you've travelled recently might affect your ability to donate blood. And another common reason for not being able to donate blood on a particular day is that you're awaiting hospital investigations or outpatient investigations for a health reason, and we want to make sure that you're fit and well before you donate. So we need to see that these investigations have been concluded with a satisfactory outcome before you can come and donate blood again. If you've been to the dentist recently, that might impact on your ability to donate blood. If you've got had a cold or a flu recently, you might not be able to donate blood. And again, I suppose that's because you might be have some infection that could be passed on by blood transfusion, and we want to make sure that you're well before you donate. Other reasons that stop you from donating blood is if there's been a diagnosis of cancer, or if you've got evidence of what we call cardiovascular disease. So that's largely kind of heart disease. And very often that prevents you donating blood as well. We've got a section you can see on the right, a table of things that we call our blood safety questions, and they are about identifying people that might be at higher risk of bloodborne viruses and transfusion-transmitted infection. And you're asked these every time you come to donate. And some of these questions are quite personal, so it's good to be aware of them. You can see at the bottom, one of the questions that we asked for, number 43, is if you've had more than one or a new sexual partner in the last 3 months, and if you've had anal sex. So there are some really quite, sensitive questions that we have to ask, but that's really about ensuring the safety of the blood. And if you've had a previous transfusion, you're not able to donate either. So what I've talked about is really about sort of general advice around and rules around blood donation, but I'm just going to touch briefly on guidance for individuals that have got genetic hemochromatosis. So if you have got genetic hemochromatosis, you're welcome to come along and donate, but you have to have no symptoms that are relating to your genetic hemochromatosis. And there are a number of rules in place, and if you are to become a blood donor, then it needs to have been approved by the blood transfusion service if you're an individual with genetic hemochromatosis that's currently getting venesection. And the criteria that we need to make you that you need to meet is that we need to preserve the principles of altruism. So you're doing this not for your own benefit, but for somebody else's benefit. That an individual with genetic hemochromatosis has to meet all the other donor selection guidelines that I've laid out in the other slides. And really that we need to know that you've got somewhere else to go to get your venesection if for whatever reason on any given day you come to donate blood and you're not able to. We need to be reassured that you have a pathway to receive the venesection that you need in an alternative manner. So that's kind of those sort of additional guidelines that are in place, again, to protect both the donor and patient in terms of safety. So digging into that a bit more deeply, it's really what are the specific guidance about the genetic hemochromatosis individuals giving blood. So if you are on or have previously been on a therapeutic venesection program, you can give blood. However, you need to be referred from the clinical team to SNBTS, and your clinical team must confirm that they will monitor your ferritin levels and that they will offer alternative venesection facilities if you can't donate for any reason. So that's really just to make sure that people with genetic hemochromatosis don't have any they don't miss out on any of their care because they came along to become a blood donor. That's really about the donor and the person with genetic hemochromatosis and making sure that they get the proper clinical care that they need. And you also need to meet all the donor selection criteria every time you come along, as any other donor would need to. So in terms of that process, in terms of becoming a blood donor with us, you can, if you're on a venesection program, you can be referred to us when you're nearing the end of your induction phase, or you're in the maintenance phase of your treatment. Then you can be referred by your clinical team to become a blood donor. There's a referral form that has to be completed by your clinical team. That's then sent into our clinical team, which is Pam and you and some of our other team, and that is then reviewed. Once we've reviewed that, if they meet the criteria, we'll add a note to your donor record so that we know that you're an approved GH donor, so that when you come along to donate blood at a session, our staff on session are aware that it's been approved and it's all fine, and they just need to treat you like any other donor that's coming along. You'll then be sent a letter to let you know, and your clinical team will also be sent a letter to let you know the outcome of that referral, whether yes, you have been approved, or no, sorry, we can't approve you to be a GH donor, and we'd provide an explanation of why that's not possible. And whether that's something that might change with time, or whether that's permanently you wouldn't be able to be a blood donor. And we normally turn that referral round in around 12 weeks' time. And so you can see that leaflet on the right. That kind of covers all the information around this and that process, and kind of what you might expect. And that is, we have implemented that recently after the sort of feedback we got from the surveys that we've done. And within the last few weeks, that information has been distributed to all the hospitals that have venesection clinics that are listed there. So hopefully you might become aware of that when you attend for venesection, that leaflet's available. And I suppose that's just to sort of raise awareness and remind people about you can be a blood donor if you've got haemochromatosis, and hopefully just to make it a bit clearer about what the process is to become a blood donor with the Scottish National Blood Transfusion Service. So once you've been approved, you'd come along to the session, you'd fill in all the forms, the donor session record that I showed you on a previous slide, have to answer all our questions. So you need to meet the donor selection guidelines every visit. Once you've completed that, then we also check your hemoglobin to make sure that's adequate. So our minimum hemoglobin level is 125 for females and 135 for males. And if you don't pass that, it's done on a sort of finger prick blood test that you might be familiar with in your venesection clinics. If you don't pass that, you aren't able to donate blood with us. The donation interval is set at 12 weeks, so you can only come and donate blood every 12 weeks. And it's unusual, but some people do require additional support for their venesection within the hospital. So, for example, fluid replacement, we're not able to offer that at the blood transfusion service, where we're a donor session and not a clinical service. So we're not able to provide support like isovolemic venesection at our donor sessions. So in terms of eligibility for people who don't require venesection programs, if you've never required venesection for your haemochromatosis, or you are a carrier, then you can donate without referral, and you can either go online and get more information online, or you can phone our donor helpline on 0345 9090 999, and you should be able to make an appointment and turn up like any other donor without needing any sort of special amendments to your records or a referral process. So once you've been through that process, become a blood donor, required to donate. Well, we've got fixed donor sites in Aberdeen, Dundee, Edinburgh, Glasgow, and Inverness. And in Glasgow, our donor centre's open 7 days a week, so there's plenty of opportunity to come and donate. We also collect blood in our community sessions, and we're really trying to return to more collection in communities following COVID. We had to sort of reduce that programme during COVID, but increasingly people want to donate in our community sessions rather than our donor centres. So this year we've got 197 community sessions running, and that's a total of 767 sessions in total, so opportunities to donate. All our sessions are published on our website, so you can book your appointment online or by calling us. You'll see at the bottom of this slide, if you go into our website, you can type in your postcode or where you live, and it brings up when the next donation sessions will be in your area. And throughout all of this, if you do have any issues, booking your appointment, we have got that helpline. Please phone up and let us know, and we'll really do our best to sort of try and resolve any issues that you might have. We want things to be as easy as possible for people, so please get in touch and talk to us if there's a problem. So I suppose just to talk a bit about the GH donors that we have within SNBTS, and just say a huge thank you to them. So we receive approximately 250 referrals a year from clinicians referring in individuals with genetic haemochromatosis. Around 85% of those referrals that come in, the individuals do become approved GH donors. And we don't have the exact figures, but we know we've got well over 1,000 GH approved donors who donate with the Scottish National Blood Transfusion Service, and we'd really like to continue to grow this number of people that are coming along to donate blood with us. And just on behalf of the patients of Scotland, is really just to say a thank you to those who come along and donate blood. You'll see some pictures on the right here, and bottom right is a family that we've been using in some of our marketing campaigns this Christmas. So it's Gran Donna Webster, who's 61, Mum Lauren Webster, who's 35, and baby Isabella, and they've all had life-saving blood transfusions. Thanks to the kindness and the donations of people within Scotland. So thank you to all of them, and thank you to all our GH donors particularly. So in terms of next step, we want to sort of continue working with people with GH, our clinical colleagues, and try and encourage referrals to SNBTS. As I mentioned, we will complete the research that we've done on trying to understand why people that have been registered as blood donors have then not come along to donate. And we're really keen to sort of develop awareness and communications, and maybe develop some case studies with people that have got genetic haemochromatosis. So, if you'd like to be part of that, we'd really love to hear about you. I think it's really important that we engage with yourselves, and I say if you're somebody that'd like to come forward and be a case study that we could share maybe on some of our news stories, then we'd really love to hear from you. Really like to continue collaborating with Haemochromatosis UK, and it's allowed us to really get some really good data, and I think hopefully put some improvements into that, but there's always room for further improvement. So we'd really welcome any suggestions and feedback about what we can do to make the process better. So I'm going to stop there. I'll stop sharing my screen. Thank you for listening, and we'll try and take some questions now. Thank you.
Thank you for that, Lorna. That was incredibly informative. We've not had any questions so far in the Q&A box. So everyone that's watching along, if you have any questions, feel free to put them in the Q&A box, and we'll get around to asking all of them. But I have had a couple of questions via email, so I'll start those. There's a shorter one and then one longer one. So I'll start with the shorter one. I'll ease you into it. So this question says, I'm 82. I was diagnosed 3 years ago with genetic haemochromatosis. My levels have been brought down to acceptable levels, and I no longer attend for venesection. Am I too old to donate blood? I do take a few regular medications.
Do you feel comfortable answering that question?
Yeah, I mean, the current guidelines are that if a donor is over age, we do have obviously age limits, but for haemochromatosis patients, we can accept donors who are over age as long as they've donated successfully and without any event in the clinical setting. So, theory, yes, but I think I would probably encourage that individual to, call our donor advisory team just to go through their health, what other medications are on. I know they mentioned that they were on some other medications, so it's useful to have that conversation first so that we're aware, are they able to donate based on other medical conditions, medicines that they're on, and if that is the case that they are, then certainly they potentially could be accepted. But again, if they have had venesection previously, they should be referred in by their clinician to the service for us to do a formal sort of review of their health condition, etc.
Thanks, Ewan.
Cool. Thank you. The next question was, this was the longer one. I have genetic haemochromatosis and I'm on maintenance, requiring about 4 pints venesected per year. In 2022, I asked my liver nurse to refer me for blood donation. I was disappointed when I received a letter back from SNBTS saying we have reluctantly decided that you are not able to donate blood under our current donor selection guidelines. Could I ask if it will be possible to give the reason when you send such a letter? and I'm sure others were also disappointed when we found, sorry. I and I'm sure others who are also disappointed would find a reason would help us understand. I am a retired consultant physician and my wife is a retired specialty doctor with SNBTS, and neither of us can see which of the current eligibility criteria I do not meet. I first donated to SNBTS as a student in 1972, but was advised not to give blood in 1986 due to onset fatigue and joint pains. Sadly, I was not diagnosed with haemochromatosis until 2017, having seen 9 different consultants for haemochromatosis symptoms over the years. Currently, at 70 years old, I swim 1 kilometre per day, windsurf when it's windy, and sea kayak on trips up to 200 kilometres. I have never had the slightest problem giving blood, and my veins are like tree trunks. The only drug I take is a bronchodilator for mild asthma. I would love to be a blood donor again. I can pick out key points if you didn't get all of that.
Obviously that, the individual has a difficult journey and a long time to diagnose their haemochromatosis, which is, is unfortunate. And I think I alluded that to my presentation, and Ewan can maybe just clarify me if I'm incorrect there. Is I think we do try and provide information about why people are not going to be accepted. So that I think that's what I think that my take home from that was that the person that was referred then didn't understand why we couldn't accept them, and that would have been helpful to understand that. Ewan, I think we do try and include that in our letters now, but can I just check with you if that's correct? Yeah. So
that's only been within the last year or so we've been doing that, but yes, we have that. We definitely give an explanation why. I think it's helpful for GH individuals to know the reason why they've not been approved. That's definitely something we do now and have been doing for the last year.
Yeah.
I think it's also worth saying as well, Lorna, we also give in our letter, we give the individuals an opportunity to phone us as well if they want an explanation, so that we do give the number as well. So we have to give a sort of one word or a sentence description of why they don't meet the eligibility criteria, but there is also the opportunity to phone in, and one of us can explain that and discuss it.
Thanks, Pam. Thanks, Ewan. So I think if the gentleman, I think it was a gentleman in that particular case, I mean, if they want to, if you wanted to feedback, I don't know whether your questions have been anonymous, but they're more than welcome to find in. We'd be able to look back at the records for that and maybe provide a bit more information. But obviously, we have changed our processes, so hopefully anybody in that position now would have that information to help them understand why they haven't been accepted. But if we can do anything to help that gentleman, we could certainly have a conversation.
Thank you. This is being recorded, so he might see it that way, but I will get in touch with him and let him know. This was in 2022 he received that letter, so obviously you said things have changed since then, so it might just have been because it was a little while ago. Thank you for that. We haven't had any more questions in the question box, so I'll give it another minute just in case anyone has anything last minute to ask. Is there anything any one of you wanted to add in the meantime, just while we're waiting for those questions to come in?
I mean, I think it's really, I just probably want to highlight that we do want to work in partnership, and I hope the changes that we have made have made things better, but there's always room for improvement. So happy to sort of to hear that feedback about how we can continue to make and whether the changes that we have made have actually made things better for people. I see Jen's got her hand up.
Yes, thank you, Lorna. Thank you, Abby. So I'm Jennifer Wilson. I'm the head of donor marketing for SNBTS, and it's just to reinforce Lorna's plea. Real people can be really, really powerful. So if any of you were willing to share your story on our website, to encourage other individuals with haemochromatosis to potentially come forward, it would be me you would talk to about that, and we would really love that. So a little plea, if you could perhaps think about it or have conversations with others from the community that you know. You will notice in the leaflet That is what we're missing. We're missing a real person given real narrative. So we'd love to hear from you.
Thank you, Jennifer. Hopefully you'll have a good response from that. I know we've got quite a few people watching. Unfortunately, we haven't had any more questions come in the question box. I think you've stunned everyone into silence. Oh, I can see Vic's raised her hand. Sorry, Vic.
Hi, sorry, I might have missed something because I took a call during that. But obviously, I'm Vic, I'm the nurse on the helpline, so I get a lot of calls from people who perhaps have tried to ring and haven't been successful and are just trying to run things past me just for advice. And what I sort of hear quite a lot is people want to know how come in Wales you can donate 2 weekly, and England 6 weekly, but in Scotland it's still every 12 weeks.
Okay, I'll take that question. So we use different IT systems in the different blood services, and our donation lockout is set at 12 weeks, and that is for and that is for donor safety, because donors can only donate every so often because of the risks of anemia or deficiency anemia. So that is our system default is set to that. And that's why it's currently set at 12 weeks. There's a potential, if we were able to do an IT change, that we could change that lockout and make it differently, but it's there for safety, so we don't want to override it, and it would require changes that allowed a sort of different programming. So that's something that we would maybe hope to progress in time. But when we did this survey last time, we identified other areas that were higher priority to resolve, and we identified that there was a small number of people that would benefit from a more frequent venous section interval, but the vast majority were happy with the donation interval that was set. So I'm not saying that's something that we won't look at in the future. But we felt that the things like getting the information leaflet out, serving the referrers, doing the FAQs, that actually those things were going to bring much wider benefit to everybody with genetic hemochromatosis that wanted to become a blood donor, rather than a smaller subset. Now, that doesn't mean that we don't want to do that work, but it's really, we have to involve our IT colleagues to do that. So it's something that we will work to in the future, but I can't say it'll be done by a year or 2 years. I think the other thing to reflect is actually Scotland has a much higher number of blood genetic hemochromatosis individuals that come to donate blood than Wales or England per head of population. We've got a lot more, so I think we focused on that making it trying to encourage everybody to come along and donate, whereas per head of population they have far fewer people with GH that come along to donate blood than we do in Scotland, even allowing for that slightly different rate of genetic hemochromatosis across the different nations. So yeah, maybe something for the future, but it's about the safety of everybody that's giving blood, and not wanting to override a safety system that's in place and it requiring an IT change to fix it.
Right. Thank you, Laura, for going into such detail as well about that. We have had a question in the Q&A box. It's from an anonymous attendee. They said, did you say we had to be symptom-free before we could be considered blood donors? I have some symptoms such as joint pain and fatigue on and off, so assume that means I'm not eligible. I used to give blood, but not done it for a while before I was diagnosed with GH.
I do. Pam or Ewan, would you like to take that question?
Yeah, we would look at the information and make an assessment. I think fatigue's a particularly difficult one to deal with because there's lots of reasons people can be fatigued. They're not necessarily related to genetic hemochromatosis. So I think we would want to look at all the information provided by a referrer and make a decision, or even, in some cases we pick up the phone and speak to the individual and speak to them. I think what we want to know is that the genetic hemochromatosis has been properly managed and investigated before someone's referred on to us.
Okay, thank you, Pam. Yeah, hopefully that answers the question. So it's Thank you.
Thank you for that. I do appreciate that. That was the only question we got in the Q&A box. I think you definitely saw Laura into silence. Bless you. Well, thank you all for joining us today, and a big thank you to the Scottish National Blood Transfusion Service for joining us today and answering everyone's questions. Really appreciate it. Thank you.
Thank you for having us.
Thank you.
Bye-bye.
Bye, everyone.
Thank you, Abby.
Bye.
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 Thank you, Jennifer.
Bye.
Bye.
Bye.